Hi everyone. Today I'm very excited to have with me a dentist actually to talk about the oral microbiome. And let me welcome Dr. Katie Lee, a dentist, speaker, and coach who lives in Colorado in the States. Dr. Lee graduated from University of Illinois in Chicago in 2010 and was a known partner in over 80 DSO supported dental practices throughout the US and in 5 states. Currently, she consults for health technology companies and provides implant education for generally dentists. Her passion about oral systemic health link comes from personal experience, and that is detailed in her book, Saved by the Mouth. Dr. Lee has won top 40 under 40 dentists in America and International Woman of the Year in Dentistry, and is a sought after expert in the media. So we're incredibly lucky to have you here, Dr. Katie Lee. Welcome to the show.
I'm really excited to be here. Thanks for having me.
Yeah, it's a pleasure. And obviously, well, I'm very excited because this is the first episode in 4 seasons already where we talk about the oral microbiome. And
yeah,
I'm so excited because we have spoken so much in the entire podcast history about microbiome as an ecosystem. But can you tell us, as a starting point, what is this mouth-body connection?
Yeah, exactly. Well, thanks for giving me the opportunity to share all this information with your audience. The gut microbiome is super popular right now with everyone. Everyone's really concerned about the gut microbiome and making sure that it's healthy and robust and diverse, because we know that we have way more genes in our gut microbiome than we do in the human body. We know that the gut microbiome is responsible for our immune system. But what we don't realize is, how did that bacteria even get into our gut? And so we got to kind of go back to the starting point of the digestive system, which is the mouth. And so we need not forget that the mouth is part of the ecosystem of our digestive system. And so the mouth has an oral microbiome as well. And that is what is seeding the gut microbiome. So as I always say, everything starts with the mouth. The mouth is the gateway to the body. And what we know through tons of research and decades of science is that the bacteria in the mouth, unfortunately, do not stay in the mouth. They get into the body via a few different mechanisms, and they can either help or hinder other places where they can set up colonies. So the mouth is tied to almost every other condition, disease state in the body.
Such a good point, right? Everything starts in a mouth, and it's
Yeah.
kind of forgotten that actually,
Yeah.
digestion in a way starts there.
Yeah.
And, I have to say, I loved reading your book, which is
Oh,
called
thank you.
Saved by the Mouth. And actually, I can see it there when you're
Yes.
sitting. And one of the key topics that you mention in the book is about inflammation.
Mhm.
And it would be great if just for our audience, if you could tell us a little bit about, okay, what is chronic inflammation and why this relation also with the mouth?
Yeah. So inflammation, what we know now is that's really the root cause of almost every disease. We've sequenced the human genome. We've looked at DNA. We've tried to figure out, what is causing cancer and heart disease and all these different ailments. And sure, there are some conditions that are caused by genetic mutations or inherited genes. But by the most part, a lot of these gene mutations are caused from inflammation. And so inflammation is there to really help us in acute situations. It's there to alert our body that and our minds that something is going on that we should stay away from, just like our parents always told us, don't touch the hot stove, right? And what did we do? We'd put our hand on the hot stove, we'd burn our hand, and the redness, the swelling, the pain, that is acute inflammation. And that served to be a kind of a warning sign for us to be like, oh, we should probably not do that again. That's not good. But what happens over time in our lifestyle that we've kind of adopted to over the years is that most of us are sitting in a chronic state of inflammation in our bodies. And what we know is that changes our genes, that increases our cortisol level, it decreases our immune response, and it can make us susceptible to a whole host of diseases. And what we know is, because the mouth is connected to the digestive system and to the gut is oftentimes when we have inflammation, chronic inflammation in the mouth, be it from microbiome dysbiosis or tooth infections, we know that inflammation, one of the very first places that it affects is the gut, and vice versa. If we have a ton of chronic inflammation going on in the gut, oftentimes we will see signs in the mouth. So it's all connected.
Definitely. It's all connected. And that, okay, that makes sense. So, okay, now we know mouth is actually super relevant in the whole ecosystem, connected with the microbiome. Inflammation and definitely this chronic inflammation can play a role in there. I mean, there are many, many topics here to unpack, but just if we can, dig deeper into the oral microbiome. In your book, right, you mentioned as well, you started to look into this particular research, right, out of the American Gut Project. And I mean, also in your book, you mentioned some bacteria and all that. And could you give us a quick overview about all these pathogens and how we can find them? What lives in our mouth and then goes to the gut?
Yeah, absolutely. So, when we say that there's a microbiome, same if, when we're talking about the gut, there's obviously a ton of bacteria in the mouth. There's viruses, there's fungi, there's all sorts of species in the mouth. But if everything is healthy and in balance, the good bacteria will keep all of the bad bacteria, the fungi, the viruses, everything at bay. It's a whole ecosystem. And so what happens is when this ecosystem gets disrupted, we move from more of an oxygen loving, aerobic type of environment to more of a gram negative anaerobic type of environment. And that's where the pathogens really start to thrive. And so we see this, what we call dysbiosis, or this imbalance between good bacteria and bad bacteria. And that's when we start to see problems. We know that, when you have a lot of this bacteria, the dysbiosis, the bad pathogens in the mouth, the body sees that as, this isn't supposed to be this way. We have an infection going on. And so what happens is the body releases an enzyme called MMP8, which I talked about, all through the book. And what I want people to understand is MMP8 is originally there to really help us. What it is it's a collagenase enzyme, which is a fancy term for, it's just an enzyme that acts like a scissor. And so when the body is trying to fight off an infection and it releases our immune cells, our white blood cells, to go to the source of infection, it has to release this enzyme MMP8 to go first, to kind of cut through the tissues and allow all those cells to get to the source of infection. Well, when that enzyme is activated, it starts to cut down our gum tissue to allow the white blood cells to get to the source of the dysbiosis. And what happens is, instead of our gum tissue, our gum tissue is supposed to act kind of like our skin, right? It's a barrier that seals off our teeth and what's in the mouth from the rest of the body. But when that enzyme is activated, it starts to cut through and break down our gum tissue. And that's when all of the bad bacteria in the mouth get into the rest of the body, because it will translocate through those gum tissues. We have blood vessels in our gums. That's why a lot of people will notice bleeding gums. It's because that's where our blood vessels are. And that bacteria will get in there and circulate the rest of the body, which is not good. So we want to try and keep the mouth in a homeostatic state, keep it more oxygen loving bacteria than the gram negative anaerobes, the bacteria that don't like oxygen. That's when we get in trouble.
It's really interesting, right? And basically, I mean, what is the role of saliva in this entire ecosystem?
Yeah,
is that a neutralizer? Is that a good thing to help us?
Yeah, saliva is awesome. I'm so glad that you brought this up, because it's definitely a hot topic, and there's so many different companies out there that are trying to utilize saliva in different ways. They're trying to use it for cancer detection, for testing for inflammatory markers in the body, for microbiome, you name it. That's what we're trying to use. So saliva is super critical to our health. And let me start by saying, for cavities, for example. So when we have saliva in our mouth, the role of saliva is many things, but one thing that it does is it helps us fight cavities or prevent us from having cavities. And it does it because it will actually coat the teeth with something called the salivary pellicle. And that's supposed to kind of serve as like a film layer over our teeth, if you will, to try and keep all of the cavity causing bacteria and gum disease causing bacteria away. So saliva is really important. And so we see patients that are on medications that reduce their saliva amount, or maybe they have conditions like Sjogren's syndrome, which is where their salivary glands will actually start to atrophy over time, and they have reduced saliva. Diabetic patients oftentimes have reduced saliva. And so we see those patients have a really high caries risk or cavity risk, because instead of having these kind of slimy teeth, which is actually what we want, the teeth are really, really dry. And that's when the bacteria can stick to the teeth right along the gum line and start to cause a whole host of issues, one of them being cavities. Saliva, we also see a lack of saliva in patients who have breathing issues. So that is really important for someone who has sleep apnea, or maybe they're a mouth breather. Maybe they have really severe allergies and they're always breathing through their mouth. That's going to dry out their tissues, obviously. And we'll see that their tissues are a lot more inflamed and that they have a lot more cavities because of the tissues being super dry. So no saliva is super bad. It's going to lead to gum inflammation and to cavities and dysbiosis. And then, in your world with the gut microbiome, digestion actually starts in the mouth. There's an enzyme in our saliva called salivary amylase. And that's released as soon as we start eating. And its job is to break down carbohydrates so that we can start the digestive process. So in patients who have reduced saliva, what we'll often see is they have really bad digestive issues to where they can't break down their food because that digestion really never completely started in the mouth. So they're swallowing larger boluses of food, and that puts too much pressure and stress on the rest of the digestive system to do that process. So saliva has a whole host of benefits.
Wow, I'm learning tons already. And Katie, there's also a question I wanted to bring up, which is I was amazed when I was reading your book, and I read all the stories that you shared there about, you seeing a patient, kind of detecting, okay, something is off here. You were implying about inflammation, and then 2 years passed by, and this patient apparently had a heart attack. And this got me thinking so much. And I thought, first of all, it's incredible. Like at least I don't generally see any dentists with this holistic and evidence-based approach. So what brought you to actually be, practicing dentistry with this such a holistic approach?
Yeah, that's a great question. It goes back to an accident that I had when I was a teenager. So I grew up in the country, and one day I was riding a four-wheeler. It was actually the only time I didn't put a helmet on, and I crashed headfirst into a telephone pole going about 35 miles an hour. I'm lucky that I am still here today. Number one, I'm also lucky I'm not paralyzed. And I'm lucky that I'm not, that I don't have severe brain damage, although, some would argue that I have a little bit of brain damage. But, I lost a bunch of teeth in that accident and broke every bone in my face from my eyebrows down. And so immediately that night in the hospital, they wired my jaw shut, even with broken and missing teeth. And my jaw was wired shut for the next 8 weeks. Couldn't eat anything. And so I was surviving off of, ice cream, pudding, Jello, you name all the bad stuff that you should never have is what I was surviving off of. And so I became severely malnourished. I dropped a ton of weight during that time, and my kidneys started shutting down. My liver enzymes spiked. And so at a very early age, I learned just how much your mouth affects the rest of your body. And even when they took my wires off 8 weeks later, I remember I really wanted to go to Olive Garden that day. Olive Garden is like a chain Italian restaurant here in the United States. And all I wanted was an Olive Garden breadstick, I remember. And so I brought friends with me to the appointment. And when the doctor cut my wires off, he said, "Okay, open your mouth." And I tried to open as much as possible, and I couldn't open at all. My jaw was completely still locked shut, even without the wires. And what had happened was my jaw joint had fused during that 8 weeks of having having my jaws wired. So it took 4 years and 9 reconstructive surgeries, one of them being where they removed my right jawbone and replaced it with my rib, and cat cartilage to reform the disc. And so during that time, I couldn't eat at all, couldn't eat healthy food still. And I had a lot of tooth issues, as you can imagine, because number one, they wired my jaw shut when my teeth were broken and missing. So I didn't have any dental care before that. And then over time, eating all the bad stuff, the teeth just began to rot, and no dentist could really get in to fix anything during that time because I couldn't open my mouth at all. And so my body was just chronically inflamed. I had infection in the mouth that was spreading systemically. I had a lot of mental, emotional, and social trauma just from missing front teeth as a kid in high school. And so that really got me into dentistry and really got me into noticing that the mouth affects the rest of the body. But the research wasn't really out mainstream yet. Of course, there were papers out there saying that the mouth affects the health of the body, but it wasn't a mainstream concept yet. I remember when I graduated in 2010, there was a paper that was published that said, gum disease is associated with heart disease. But that was big news back then. Now we know, obviously, that there's bacteria that are directly linked to it from the mouth. But what I started noticing in my practice was, patients that would come in that had gum disease or tooth abscesses also had all of these other conditions. So I would see people with heart disease. I'd see people with diabetes, with gut issues. Arthritis is a big one that a lot of people don't connect. Arthritis is directly related to our digestion and our gut health, as well as our oral health and inflammation, dementia, Alzheimer's. And so if someone had an unhealthy mouth, they also had systemic disease. I never saw someone who had an unhealthy mouth and who were completely healthy systemically. It just didn't exist. And so I just started doing more and more research on my own, and just figured out, like, hey, we got to start treating patients as entire beings, entire humans. We can't just keep isolating. And, I'd have a patient come in, they'd have these oral issues, they'd also have a systemic condition, and I would try and send them back to their physician or care provider to get tests done to try and help me help them get their patients healthier. And I just realized that this knowledge of oral systemic health doesn't exist. And so that's, kind of the impetus for me writing the book, for doing all these podcasts, and for creating my new health center. Is I'm trying to get the knowledge out there because it exists. We know that the mouth does affect our systemic health. And I believe patients have the right to, have access to the best knowledge and the best healthcare out there, because it's not expensive. It's pretty easy stuff to fix.
And yet very important. Yeah.
Yes.
But Katie, thanks so much for sharing your story. It's actually, it's impressive, right? That out of all the challenges and hardships, you were so inspired to start your career and focus on dentistry, and especially with this holistic evidence-based approach, which is clearly missing out there. Yeah. No, it's super inspiring. And obviously focusing back on, the role of oral microbiome and all the pathogens that you mentioned. I mean, in the book, you emphasize a lot on testing. And I was wondering if you could share with us, like, what's something common you do in practice? Like, first of all, you do some checks, or what's the role of testing in that context?
Testing is so important. And we haven't, dentistry is so far behind the medical profession when it comes to testing. And it doesn't make any sense, right? Because if you're sick, you go to your physician. They don't sure, they'll do a physical and they're kind of feel around a little bit, but what do? They order a whole gamut of tests to try and figure out what's wrong. But in dentistry, the only thing we've really ever done in the past is rely on 2D x-rays, which are completely outdated and don't show us a whole lot of information. And then everything else is subjective. So it's, what is your pain? What are your symptoms? What do I see? What do I measure? And we've never really used a whole lot of tests in dentistry before to get these diagnoses. And now there's so many companies coming out with amazing tests that we can use to try and figure out what exactly is going on in our patients, and then tailor our treatment to whatever is present. So for example, a big thing that I am a believer in and that I use all the time is salivary testing. And this is what I talk about in the book, is we have tests for gut microbiome, right? We can do stool tests and blood tests, or not blood tests, but stool tests for gut microbiome. Well, we can do saliva tests for the oral microbiome to try and figure out what is going on. Because we know, for example, I typically will test for about 11 different bad bacteria or pathogens in the mouth. And what we know from that test is over half of them are resistant to the traditional types of cleaning to treat gum disease. And so this is why, we started treating or identifying gum disease really and doing products and all kinds of treatment back in the 70s, but we really have not made a dent in, number one, preventing gum disease or getting people better. So the whole idea is, let's figure out what is present in the mouth. Let's tailor our treatment to kill those specific pathogens so that, number one, we can hopefully prevent gum disease if we catch it early enough. Or number two, get the patient better so that they go into remission. And this isn't something that's going to affect them systemically. So testing is so critical. So saliva testing is just one thing that we can do now. We can actually measure the level of MMP8. MMP8, that enzyme I was talking about earlier, that is the connection between the mouth and the body. So without the gum tissue breaking down, sure, we're swallowing, a liter of saliva a day, which is kind of gross if you think about it. But most of the bacteria that we're swallowing is going to get destroyed in the stomach because the stomach acid. Some of it will make it through, but majority is going to get destroyed. And so, the real connection between the mouth and the rest of the body is going to be this enzyme. So we actually have technology now that we can measure how high this enzyme is. And then we can target, do specific therapies to get that enzyme down, so that our gums stay being a physical barrier. If you're walking around and you had holes in your skin, you would not just put everything in the environment on your skin, right? You would bandage it and try and seal off your skin because you wouldn't want to get an infection. Yet people are walking around daily with perforated gums. We talk about leaky gut. Well, that's what gum infection is leaky gums. It's perforated. What's getting into your mouth is getting into the rest of the body, and that's not good. So testing is so critical, especially if we want to prevent disease or help patients improve not only their oral health, but their systemic health.
Yeah, and as you said, right, you mentioned something very interesting, which is nowadays we more and more have the technology, right, of, evidence-based testing and all that is very powerful in terms of insights that can provide. So that's, definitely very interesting. And, I guess, what you're doing, which is fantastic, is education as well, right? So part of preventing gum disease as well is, okay, let's educate, let's raise awareness, and what can be done also. As you said earlier, right, it's not super expensive, or there might be ways where basically we can prevent gum diseases. And my next point of conversation was, okay, what can be done? Like, what are the practical steps that you recommend our audience to take care of their mouth and therefore overall health?
Yeah. I want to touch on the piece you said about education real quick. Because since this is such a new concept of how important our oral health is to systemic health, a lot of patients are unaware of this. And so they'll come in thinking that the dentist is trying to oversell them on, expensive treatment that they don't need. So these tests are also important to educate the patient that something is going on, because gum disease and gum infection often presents as a silent condition, same as tooth infections. Sometimes people will have abscesses on their teeth and not know, maybe they have an old root canal that has gotten reinfected. And they won't know because they don't have any symptoms. This is very similar to, heart disease doesn't hurt until you have an end stage event like a heart attack. Diabetes doesn't hurt, right? The only way you know you have diabetes is if your dentist, or not your dentist, if your physician does, a glucose test or an A1C test. So it's really important to do these tests to educate the patient that just because you don't have symptoms doesn't mean that something is not okay, if that makes sense. And so I would say that is super important. And then in terms of what should people do, I think what I always tell people first is go get checked. These tests are a couple $100, and it's really important to know your bacterial profile to see if anything is wrong. Because if something is wrong and you weren't aware of it, the longer that disease process takes place, the more damage is done to your mouth and to the rest of your body, and the more expensive it is down the road to get it treated. So the sooner you get a saliva test, the sooner you get a diagnosis, the sooner you get treatment, the less money you're going to spend and the healthier that you will be, and the higher chances you have of being able to return to health. It's just like, if not as serious, but it's just like if you have cancer, right? Like, you don't want to wait until you start to have severe symptoms, pain, because then it's usually in stage 4 and it's everywhere. You want to catch it early because that's the least invasive treatment that we can do. It's the least expensive, and you have the highest chance of great outcomes. So get a saliva test, see if there is an issue, and then you can treat it. The treatments will vary depending on the bacterial profile. The base treatment, if there is something going on and there is already bone loss, is to do what we call a deep cleaning or a periodontal cleaning, which is a cleaning below the gum line. So a lot of people will say, well, can't I just get a regular cleaning? A regular cleaning cleans above the gum line. And what I was saying earlier is that we, in healthy patients, their microbiome is filled with oxygen-loving aerobic bacteria. Those are bacteria that live above the gum line. If you have a gum infection, that's because you have the gram-negative anaerobes or oxygen-hating bacteria. Those live beneath the gum line. So regular cleaning that cleans above the teeth where the oxygen is not going to treat the gram-negative bacteria below the gum line. So oftentimes we'll start with a deep cleaning, and then depending on the bacterial profile, we may use medicaments, we may use laser or ozone or other things to try and get rid of those bacteria that live down there. And then after your dentist gets you healthy, it's really easy for you to maintain that health at home. So a lot of times patients will contact me and say, I don't want to go see the dentist to get treated. I'm going to oil pull and brush with charcoal toothpaste and do all these homeopathic methods to get healthy. That's a really good way to stay healthy, but you got to get rid of the etiology, which is oftentimes hardened bacteria underneath the gum surface, first, in order for you to maintain. Once you have that buildup beneath the gum line, there's no way for you to get that off yourself. So go see your dentist first, and then they can give you the tools afterwards to stay healthy on your own.
And that's a great reminder. I think, many of us somehow we don't think about that. And it's such an important thing to go and see your dentist. Yeah. And I really appreciate it. It's really awesome to have you on the podcast. It's so nice to see, all the ecosystem of clinicians and experts, and you definitely bringing in this new angle and reminder.
Yeah. I think for me, sorry to interrupt you. For me, and what I was trying to get across with the book is, if you have a condition, maybe you do meet the threshold for an actual diagnosis, but oftentimes people will have symptoms that don't yet qualify for a diagnosis, because typically you have to have, some sort of ailment and chronic inflammation for about 5 or 10 years before you meet a threshold of a diagnosis in the medical system. So if you're having these symptoms, or maybe you do have a diagnosis and you're undergoing the treatment, but yet you're still having ongoing symptoms and you don't feel completely well, well, go check the mouth, because I can pretty much guarantee you something is probably going on in there. And if you can get that treated, your symptoms will improve or go away.
Yeah, it's there was, this quote, I think it was Hippocrates, right? That all the disease in a way, they're kind of connected with the mouth, and is definitely, a key fundamental piece of the whole puzzle. Yeah. And Katie, I always ask this to my guests, and I wanted to know, what do you do on a daily basis to take care of your gut health and obviously mouth health?
Yeah. A lot. Okay, let me let me try and start. But it's nothing that is super revolutionary. A big thing, and one thing that I really personally have to focus on, is making sure that I get enough fiber. Fiber is so crucial for us, for our total health, for blood sugar control, for weight control, for immune system. Our fiber helps us with our short chain fatty acids, which ends up producing the GLP-1, which people are paying hundreds, if not thousands of dollars a month to get drugs like Ozempic when really if they would just eat more fiber, they would have GLP-1 being produced naturally. So fiber is super critical. And so I'm always trying to make sure that I'm getting enough fiber. That's really, really important. Number two, another thing that I always struggle with, but have to remind myself, is water. I don't like to drink water. I don't like the taste of it. I think it's just kind of boring. My body can run on, chronic dehydration, which is not good for it. But water is a great way to keep things moving through our system. And it's a great way to detox. So fiber and water, I would say, are my two big things that I focus on. Another thing is protein. You never want to be protein deficient ever. Protein makes up almost every enzymatic process and every tissue in our body. So always make sure you're getting tons of protein. So whenever I'm eating something, I always eat protein first. So I prioritize protein. I don't count grams or anything like that. I probably should, but I don't. I just try and make sure if I'm having a snack or if I'm eating breakfast, lunch, or dinner, protein is consumed first, and then I try and do vegetables next, but that's not always the case. But I'm happy if I can do protein first. Then in terms of oral health, so I use an electric toothbrush, minimum twice a day for 3 minutes, not just 2 minutes. And that's because I have a predisposition to systemic inflammation. And I know this because I did a saliva test. So I have the IL-6 gene mutation. So I have to be extra diligent about my oral health care. So I do 3 minutes twice a day on my electric toothbrush. I use very gentle products. I don't use anything, that has a ton of chemicals or alcohol in it. So gentle toothpaste, I floss twice a day, gentle mouthwash, tongue scraping. So that's really important. When I sleep at night, I use mouth tape because, when we sleep, typically our mouth will open up. That's when we start to dry things out, which causes dysbiosis. So I use mouth tape at night. And then I take a host of supplements every day. So I take a probiotic every day. I also take PQQ with, which is CoQ10 with another long name. It's for mitochondrial health. That's really important for oxidative stress. I take N-acetylcysteine, which is a precursor to glutathione, which is also a detox agent. Vitamin D3 and K2, which is critical to overall health and oral health. Let's see what else. Selenium, choline for brain health.
Wow, it's quite an impressive list.
Magnesium.
I have to say.
Magnesium is another one. Yeah. So
wow.
I take a lot. I've always been a big supplement believer.
But that's a great list, right? And you touched great points, starting with the fiber, the hydration, and definitely gonna emphasize on these oral tips that you mentioned. So our audience also can remind themselves of that. Okay, well, amazing. It's been really, really, really insightful. Thank you so much, Katie.
Yeah, thanks for having me.
Thanks to you, really. And how can the audience find you? What's the best way to follow you?
Yeah, I would say that the best way is probably Instagram. So Katie Lee DDS on Instagram. Message me there. I'm really good about responding to those messages. I also have a website, so katieleedds.com. You can book some time with me. You can either book a saliva test or book a business meeting with me on the website. Also on LinkedIn and Facebook, same tags. Katie Lee DDS is pretty much everywhere. And then the book is available on Amazon so that people can look up Saved by the Mouth. Or I have a landing page for savedbythemouth.com as well. I always encourage people, go on my website, katieleedds.com, or go on savedbythemouth.com. And you can actually download the first chapter and read it first before deciding if you want to buy the book. I don't want people to buy the book and not like it. So I've been able to put the first chapter online for free for people. That way they can, get a little taste of what's in the book before deciding to purchase.
All right. Well, amazing. We'll make sure to add all the tags that you mentioned. Cool. And it's been a blast, Katie. So we'll follow you. Yes. Hope to see you next time then.
Thank you so much.
Thanks so much. See you soon.
Bye.